Perfect. So in order to do the low 4-point, all this area was prepared aseptically. Now what I do is I do one last swap to make sure it is aseptically prepared. I palpate the bulb of the splint, the distal splint bone right there, and I'm gonna go right underneath that splint bone, and then I'm gonna put my anesthetic right there, and I'm gonna put about 1.5 to 2 centimeters, 1.5 to 2 centimeters square or millimeter or cc's, okay? Then that's 1 point. Now the next point is I'm going to do 2 fingers and I'm going to go up, right? So the next point, I'm going to palpate where I did the last point, 2 fingers, and right there I'm going to go in about 2 or 3 millimeters, and I'm going to inject 1.5 to 2 mLs. And guess what? Sometimes I go all the way and I inject 3 mLs. It's okay, you know. That is not a huge deal. So right here, distal splint, 2 fingers proximally, and we go here. What are we trying to avoid? We're trying to avoid the coffin joint, and we're trying to avoid the tendon sheath right there. And then that's 2 points. So I'm going to repeat the same thing from the other side. Let's go do it. So now we're going to do the other 2 points, which is from the inside. I'm going to swap just to make sure that we have an aseptic technique. I'm going to palpate the distal splint. I'm going to go right underneath, right there, and I am going to inject between 1.5 to 2 cc's. Then I'm going to come 2 fingers proximal to that injection, and I'm going to go right here, and I'm going to inject the same thing between 1.5 and 2 mLs. 2 fingers proximal to the splint. Now bear in mind that right here, to find the neurovascular bundle, I'm gonna go right between the tendons. All right, we're not gonna go in the tendons. You're gonna palpate the tendons, and you're gonna go right between the tendon and the suspensory. There's a sweet spot right there where the neurovascular bundle sits. Okie dokie.